Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And our guest today is Sameer Sethi, SVP and Chief Data and Analytics Officer at Hackensack Meridian Health. Welcome, Sameer.
Thank you, John. Thanks for having me. Really excited about this opportunity.
Yeah, I mean, I've wanted to have you on for a while and schedules didn't work. So I'm glad we finally have you here. But before we dive into today's topic, which I think is the topic du jour of healthcare AI, before we go there, tell us a little bit about yourself and Hackensack.
Sure, absolutely. So Hackensack is a health system based out of New Jersey. We are a very local health system consisting of 18 hospitals across the state. I function as the data analytics officer, and I reside within a department called Digital Technology Services. My focus areas are data analytics, robotics, process automation, and AI. Me and my team and I help bring these technologies together and make the best use of of these technologies for our workforce, for our patients, and try to make sure that we are using the dollars that the health system generates through caring for patients in the right way.
Wow. I was just thinking, like, I don't think most healthcare organizations have a chief data and analytics officer. Like this, it's pretty nice that Hackensack has someone like you to do this. Like it's kind of like subs of all sorts of different titles. Like it's pretty unique for you to be able to do this, right?
Yeah, absolutely. I think versions of this role exist. Really depends on the maturity level of the organization, how much they are data driven and insights driven. I myself have worked for various organizations where data is seen as from the if you look at the view of how data is generated and used, there are folks that just do the bare minimum, or organizations just do the bare minimum, and others that are excelling at it. Hackensack Meridian Health took a pretty strong step in making themselves data and analytics available somewhere around 3 years ago. That's when they hired Cash Patel, who I report into as their CDIO, and then he brought me in to take this further. So definitely a lot of investment has gone into that into this. Health systems across the nation have done this in various different ways. I wouldn't say there's a right way of doing it. Definitely, I think hiring talent that focuses on this and makes this their core job definitely, I think, pays dividends over time.
Yeah, definitely. I mean, if we say data is the gold of healthcare, then it seems like you want someone to tap into that gold, right? So I think that's interesting. Well, as I alluded to,
It's
yeah,
also
go
about
ahead.
having the data, but then doing something with it as well, which is converting the data into actionable insights. That takes quite a bit as well. For years we talked about transforming data and data warehousing. All that's great. It's really important. But the focus, at least for me, in the last 7 to 8 years, has been how do you turn that into actionable insight, so that data is presented in a certain way by which people can do something about it, take better decisions, take faster decisions, and things as such.
Yeah. I don't know a single healthcare organization that wants another data warehouse. They want the actions from maybe a data warehouse as part of it or a data lake, but they want the results from the data being used. So that's an interesting evolution in the field. I alluded that we're going to talk about AI, so let's go there. What do you think about like the use of AI in healthcare? Where are you seeing it like most useful? And how do you approach finding the right places where AI should be used in healthcare?
Yeah, so I'll start off by saying that it varies by industry, as you can imagine. The use of AI, the right use of AI. In healthcare, the way and this has evolved, especially in the last year and a half or so. I remember John speaking to you, at one of the shows a few years ago, and it's weird how you and I were actually talking about AI and generative AI much before the storm came in. So I think with drawing that line there, what we have seen is how we approach AI and use AI has drastically changed today. And again, my answer would be different, slightly different. A few years ago, we see the use of AI in five buckets. One is creating equitable experiences. This is where we are trying to make sure that we use AI and technologies such to improve the experiences that our employees, our workforce, which includes our physicians and especially our patients have. The second bucket is streamlining administrative efficiencies. This is where we are using AI to do things that are required to manage a health system. There's things beyond just direct patient care that we do, and it's really important. And there are a lot of opportunities where AI can come in and help with that. The third is capacity management and burnout elevation. This is where we are trying to use AI and capabilities as such to better manage our patients and also better manage what our workforce is working on so there isn't as much burnout. There's a, for years we've been battling burnout within physicians, burnout within nurses. A lot of that was elevated and brought to surface and brought to discussion during COVID, but there's a lot of opportunities where AI can help with that. The fourth, and to me, that is the biggest bucket or where we'll start to see impact of AI over time is going to be disease detection. This is where, a lot of conversations around data science and AI happen around predictions. But I think there's a place in a very large conversation where we are using data and AI and such capabilities for prediction, but also early detection. That's what Hackensack is working on and has been working on for quite some time, even prior to the boom that happened the last year and a half, which is where we're using AI to early detect disease. This is helping physicians and clinicians take decisions much earlier than they generally would have without those data points being organized for them to see in a certain way and then take a better decision for a patient and their families. And the last one is precision medicine or precision treatment. The conversation on precision medicine has happened and has evolved over time. But today, what we are seeing is we can use AI and even generative AI to start to create or easily create treatment plans, which includes medicine, which includes care, and AI can help with that as well.
Interesting. I love those 5 buckets. What a great way to frame it out. I think it's amazing you said that the fourth one, the disease prediction and detection, that's one of your biggest, because I think many are afraid to go to that one. Like there's a lot of fear. They're like, okay, I can do my revenue cycle, but disease, like that's a little scarier. How do you navigate kind of that and also even measuring the impact of it, because you have limited resources, every organization does, and so how do you balance that and make sure that the AI being deployed is done in a way that benefits the organization and your patients?
Yeah, so we've I've done AI for quite some time. The whole world has been doing AI for quite some time. If I had to go back, if you were to ask me what's one thing that you would change
Mm-hmm.
around what AI has done, how we have done AI, for me, the first thing that comes to mind and comes to mind again and again is workflow,
Mm.
right? We as folks that have built these models to do early detection and early prediction, we have focused on accuracy, which is very important. What we haven't focused on is workflow. How do we make sure that after we build the model, that it actually fits into someone's day to day, whether it be a doctor, right? Whether it be somebody sitting in supply chain, ordering band-aids, right? How do you make sure that the artificial intelligence or the intelligence or the insights, hits the person doing that order, talking to that patient at the right time? And that's what we have focused on. So an example that I will use is an example that's at least very, very near and dear to me for various reasons, but also the fact that physicians at times get so passionate about treating the patient that they forget about end of life care.
Mm.
That's really important. I've gone through that as with my family members,
Sure.
and that's where I felt that we have built prediction models, but we haven't focused on when does that physician need that insight. So what we have done at Hackensack Meridian Health is build models that, for lack of a better term, are predicting mortality. The reason we do that is when we predict mortality in chronic care patients, that reminds the physician to think beyond treatment. And when I say treatment, not end of life treatment, right?
Sure.
And start to think about end of life treatment. What that allows the clinician to do is pause, think about if that is more that if that is now it's now time to consider that, and then take further steps. So we've built AI to, if I sum this all out, we've built AI to detect mortality or early detect mortality. As a result of that, the physician is then triggered to start thinking about it, and perhaps even based on the condition of the patient, allows triggers the clinician to have conversations with the family about end of life treatment, if that's what it takes, if that's where the
That's
patient
what the
is.
doctor
Uh,
thinks.
and then also engage with other team members, right? So which is the palliative care team or the hospice team to come in and do an evaluation. A lot of that, what we noticed is it was getting missed, or it was happening too late in the game. We consistently saw patients who were going directly from care to hospice, and the avenue of palliative care, for example, wasn't thought about, and that's where AI comes in and helps.
Interesting. It reminds me of this geriatrician I know in Vegas. He said, "John, I don't do forever young. I do aging gracefully." And but we don't want to have these conversations, right? They're scary, they're intimate, they're personal. And so that's interesting that you're using the data to help support these challenging conversations. I love that. What an interesting approach. You know, yeah. I mean, there's so many ways we could talk about this. I love that you're doing it in a whole variety of ways. And I wonder what your perspective is when it comes to regulating AI. Let's talk about that. Is regulating AI good or bad for healthcare? What's kind of your view on AI regulation?
Yeah, it's a double-edged sword. That's how I put it, at least. Regulation in AI is much needed,
Mm.
right? I'll add that, outside of regulation, there's also governance, right? So I think governing AI is more important than regulating AI, but I think
Hmm.
regulation is important as well. Regulation is important because, in my mind, it starts to mandate the a way by which things are looked at in a certain way. So an example that I will use where it comes down to, I guess, borderline regulation is the situation that we're going through, where today, as us as a health system, we have over 500 applications in production today, right?
Wow.
And each of those, think of those 500 applications as 500 vendors who provide those applications. And all these applications, or all these software developers or vendors, to stay relevant, are now flashing an AI card saying we are AI enabled. Us as a health system are not equipped to evaluate each and every application for safe AI. What regulation needs to bring in is some sort of mandate where these vendors are required to to uh, follow some sort of a methodology or a framework. For example, what in security would be NIST, NIST, right?
Mhm.
What that allows for organizations like us to do, and when I say organizations like us, organizations that are more service oriented versus product development, it allows us to trust the framework that they follow, and at least have worry maybe 50% of the problem there, and then evaluate the rest 50% of the problem for its best suit for the use case and for Hackensack Meridian Health. That doesn't exist today, and in our opinion, regulation will bring that.
Hmm.
So where regulation is really important is creating an environment, right? And perhaps maybe a mandate that requires organizations that are building AI to follow a certain framework or frameworks, which will allow consumers to start trusting it and standing behind those frameworks, so we don't have to do those extensive detailed evaluations that we have to do today. So that's the regulation part of it. The bad part about this is over-regulation will also stomp innovation. What we have benefited in the last 2 years is the fact that everyone is trying to do AI, which has come up with lots of great things, but some bad things as well, right? But I think we want to make sure that the right balance is maintained between not stomping innovation, but at the same time starting to create a governance model or a way by which we can scale the use of AI and even adopt AI.
Yeah. It's such an internal question because I think most of us agree that good regulation helps. But how do we ensure that it's good regulation that's actually going to help solve the problem, which I heard from you and I hear from other CIOs, which is, man, how do I make sure they're doing this right? That they're doing, this in an effective way, in a way that's safe, that's secure, that, and I think it's interesting, ONC has been pushing kind of this nutrition label concept for AI, where you have almost a nutrition label talking about how the AI works. So I think that's an interesting evolution, which is more informative about how you did it and the process you've done, rather than trying to over-regulate and stymie the innovation that's happening. Anyway, there's a lot going on in that space, though.
Absolutely.
Yeah. So, before we, cut to some other things, what are some other, are there some specific AI use cases that just have you jazzed? I love the one that you shared. Are there some other ones that you're like, man, these are really fun to watch and they're really making a difference, or will make a difference as it evolves?
Yeah, I think a lot has a lot of good use cases are now starting to come out. People are starting to step out of the hype and really talk about where it applies the most. And some of them are very simple and some of them are very complicated. A simple use case for me would be, think about, and this is something that we've been venturing down path of at least developing at Hackensack. We at I talked about capacity management being one of the buckets. We do a lot of planning that, and I'll simplify this further by saying we put a lot of planning, a lot of work goes into planning for appointments, for example,
Sure.
right? And patients don't show up. And when we have gone into, so no shows is the terminology that's
Sure.
used there, is
Big problem for every organization.
a major issue that we plan for these people and people don't show up. So all the planning that we have done by taking an appointment doesn't really end up in of use, when in fact we could have used that staff elsewhere. Um, AI can be used today to not just help make an appointment, and perhaps maybe AI is not required to make an appointment, but think of AI being an enabler to have the patient think about whether they can get to the appointment or not, right? So the use case I'll use is, or at least what we've been working towards is a nudge at the time of making an appointment based on geolocation, right? If the patient chooses to allow that, to say, okay, you have scheduled the appointment at 9 o'clock. You're based out of this location. It will take you 45 minutes to get to get to the appointment. Can you leave by an X amount of time? That's a simple use case, right? That those
Yeah.
calls and that technology exists today. But what that allows the patient to do is just not make an appointment, but as a part of that process, use AI to figure out how long and remind the patient that it'll take you X amount of time to get there. That starts to at least cut down reasons of why people don't make it to appointments. And there are other reasons as well. But this is
Sure.
a pretty big reason as well. And that's where, I think a simple use of AI can go a long way.
Interesting. I love that example. And it's combining multiple technologies with AI to educate the patient on something they probably should have done on their own. And some do, but obviously not enough of them. And it may be a little unique to your area too, right? If you're in a rural town where it's 5 minutes,
Yep.
it's 5 minutes, it's a little different as well. But that's interesting. Um, moving beyond AI, what about some other technologies? You know, it seems like all anyone can do is talk about AI. You even talked about all your vendors all, hanging the AI sign on their website, right? Whether they're AI or not, it seems. But how do you make sure that you're not missing other technologies in this AI frenzy?
Yeah, we're trying very hard while we want to cater to the needs of folks that want to talk about AI. We're trying very hard to also make sure that we have a tech-enabled conversation, right? Which is, I mean, I can tell you across the industry, when I'm, and you are going to shows, what we hear is, I want AI,
Hmm.
right? And our what I struggle with that, because I want to have the problem conversation, not the
Mhm.
not the tech conversation of how it's solved. AI is a means by which you can solve a problem, and there are other technologies as well. For example, robotics process automation. just digitization in general, right? ERP, there are lots of technology and tools out there that have to be combined together, and that's what my team does here, right? Which is, so if I look at my team today, I have folks that collect the data and transform the data. I have folks that build AI. I have folks that build software. I have built that folks that build robotics process automation. The reason I have that variety of folks in the team is we want to have a tech-enabled conversation, right? AI is not the solution for everything. Uh, what we want to do is we want to go in and have that conversation of what is the problem that we are trying to solve, right?
Hmm.
And once we understand the problem is when we come up with the right solution for it. And sometimes it's AI and sometimes it's not. So for us, at least internally, and I think we're trying to spread the word in that order, is not having the AI conversation, right? We're trying to have the we're trying to go back to the problem conversation of what is the thing that you're trying to solve, and then we bring in AI, robotics process automation, or, digital front door, whatever it may be, to help solve it.
Yeah. It's interesting because I've heard this from a few different people, obviously, in the conversations that I have, where it's like, I want to solve the problem. I don't want to just find AI and apply it to the solution. And that part makes sense, right? Everyone agrees with that, right? Like, we don't need technology searching for a problem, right? But what we do here is probably a CEO saying, why are we not using more AI? Which to me is a different question
Different question.
than why aren't we using this AI, right? And I think when it comes from the CEO perspective, it's more about, hey, I see this technology evolving and I see it can solve problems. And why haven't we found the problems that it needs to be solved? Like, are we not looking at the problem? I don't know. I think that's, and to be fair, why aren't we using more AI is a bad question probably for a CEO as well. But I think from their view, it's probably like, are we not looking at the problems and how technology could solve our problems better than we have in the past? Anyway, it's this interesting balance depending on perspective too around AI, right?
Yeah, I think AI needs to be and should be an agenda for the CEO. I mean, it has to come from top and then trickle down. Having said that, I think I've seen a lot of organizations put AI as their KPIs or measures of success, right? And I feel
Which
that's
is
what's
wrong
wrong,
too.
right? It's I think what the leadership needs to dictate is we need to optimize processes, right? We need to be better at taking decisions. We need to take better decisions. We need to take faster decisions, and there are various technologies that can get us there, right?
Yeah.
So I don't think AI should be a goal. It should be optimization, better decisions, maybe potentially even better finances. Those I think are the right things to go after versus I want AI.
Yeah. Well, and I think the core to this problem is healthcare is a little bit behind. We often don't need AI to solve some of the problems we have. But if I'm a CEO, I'm probably looking at it and saying, wait, so are we so far behind that we're not using AI in any of these solutions? Or are we so far behind because we aren't looking at the latest technology? Or are we so far behind because we don't understand our problems and what needs to be solved? So I think that's probably the fear they have as they address it, right? And they see AI evolving in other institutions as well.
Yeah, absolutely. I think healthcare is behind, but what I will tell you is that it's happening really fast.
Yeah.
And it's not just, I think, the operators but also the consumers, right?
Mm.
I'll give you an example that I've used in the past. I have experienced this firsthand, where I've gone to folks that are a bit older, and I'm taking this prior to COVID, where I've gone to folks who are, or elderly folks in my family, and I've told them, and or at least recommended if they would want to take a televisit instead of going to the doctor, and they've said no. And if you forward to today,
Yep.
and then I have recommended them going to the doctor, they have instead told me, can I take a televisit instead? So I think things have flipped, right? I
Mhm.
think what COVID has done is it has or the way by which we think about technology and where technology should be used has evolved, right? And therefore, I think that has pushed the envelope much further when it comes down to tech enablement. So us as a health system, what we are experiencing is the need and the ask from our consumers or our clinicians of what AI can do and other technology can do for us. We didn't see that level of acceleration or that huge ask coming from the consumers of these technologies in healthcare before.
Interesting. Well, let's take a look forward. What are you looking forward to in the next few years? Is the focus of AI going to go away? Is it here to stay? Is it going to be all AI? What do you see kind of, over the next few years? Where are we headed?
Yeah, it's here to stay for sure. It's not going anywhere. I think what we will do is we will mature as a as a community and make better sense of what AI is and what AI isn't. I when I speak about AI and what's happened in the year and a half, I compare this to 1995, and I'm dating myself here, but where we all got those 56K modems, right? And we were able to connect to the internet, but we didn't really know how to use it, right? It took us a
Mm,
while to get used to how to get to the internet and how to use it effectively and what to trust and what not to trust and what to rely on. Uh, I think that's where we are at the current moment. So in the
interesting.
next couple of years, months to years, organizations and consumers of AI will mature to using AI the right way, whether it be the generative AIs, chat GPTs, and others of the world, or even more complex solutions that organizations provide. But I think what I'm looking forward is that maturity of the use of AI, the ask of AI. That's really exciting. That's what we are doing at Hackensack as well. Is we're promoting education of AI so people understand what AI is and what AI isn't, so people can ask of the right things. So I think
Mhm.
educating the public, educating our consumers will go a long way, and people are getting there. It's happening. That's happening fast as well. So that's what I think I'm looking forward to is better conversations around AI and just removing hype out of the conversations.
Yeah, I love your analogy. Just extending it, like we knew some use cases, but then there were a bunch of use cases we couldn't even think about because it wasn't possible before. I think it may be even more so when the iPhone launched. We didn't know what an always on, always connected GPS accelerometer package could do because we couldn't have thought of those inventions until it was created. So I think we are in that incubator stage of like discovery still, and seeing what matures and what the creative minds put together. I like that. Interesting. Well, we always like to wrap up these episodes of our podcast with a little career discussion. So what would you say is the best piece of advice that you've gotten in your career?
Uh, I've gotten a lot of advice. I take a lot of pride in saying that I'll always be a student, and
Mm.
so I ask
I
people
mean,
for
that's advice right
advice.
there.
Perhaps I'll always learn. But two things come to mind, if it's okay, John. Is
Yeah.
one is actually somebody who I worked for a while ago told me that the way you think about your job today is not what it was 5 years ago, and the way you think about your job today will not be what it
Mm.
was 5 years from now.
Yeah.
So I think continuously evolving is really important.
Hmm.
And isn't about changing careers. That's not what this is. It isn't really about getting better, which you have to get better at as well. But being open to where the industry is going, where technology is evolving is really important, and keeping up with that, and doing your best in making sure that you're picking all the good from that pool of things that come out, and applying it to what you do day to day for the organization, and in my case the patients we serve, is really important. So I think that's something that I always at least on a quarterly basis check and make sure that I'm evolving.
Nice.
It's a fast-paced area for us. Technology, being in technology for all this time, things continuously evolve, and separating the hype from not the hype, and sustaining growth when it comes down to using that technology, all that has to be balanced out really well. Uh,
Nice. Good advice.
The second, and which is I guess personal and also professional as well, is consistency is really important, right? Is being organizations, and as I've grown in my career, what is expected of me and my team is to be consistently good versus finding those spurts of,
Mm,
right? I think sports are also important of energy and ideas and and creativity. But I think what's really important is being consistent, showing up, and making sure that you deliver quality day in and day out. That's really important as well. I tend to struggle with that, not from the fact that I'm not consistent, but also the fact that I love to go after the high energy, high areas, for example, AI and things as such. But in my role, I need to also make sure that that the data warehouse is running and the dashboards are producing correct data, right? So I think balancing consistency and spurts, I think that's something that's really important for career growth and career in general.
interesting. See, and I was thinking of your advice a slightly different angle around the people I like to be around are the ones that are consistent. That I know if I go to them, am I going to get good John or bad John? I hate people like that, right? Like I want to know that if I go to them, that I'm going to get a consistent person, and and it's fine if it's variety, right? Someone that's consistently going to be critical and assess it and help me that's fine too, right? Versus someone that's always going to be rose color, right? Yeah, but I like to know that when I go there I'm going to get something consistency. So anyway, I would apply it to people as well as consistent output of solutions. Very interesting.
And you'll see, as you at least I, well, when I do my quarterly planning, I tend to look at objectives or qualities, and I say, for the next 3 months, this is where I have to show a growth spur or I have to be consistent. And you can't be a growth spur across, like it's just not
Yeah,
sustainable, right? And organizations don't. So you have to continuously evolve in that aspect. So create that list of things that you have to be good at, and decide, is this for the next quarter, do I have to be consistent about this, or do I have to grow in this space? And that's how you balance out.
that's awesome. Sameer, this is excellent. I love learning from you. I always, every time I see you at conferences, get a chance to talk with you. I always learn a lot. So I'm glad we finally got you on the CIO podcast. Appreciate that. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Sameer.
Thanks, Sean. Really appreciate this. Nice talking to you.